Uh, okay, I think we're ready. Good morning, and today we're gonna present another infrastructure part of our dashboard. This is the Atlas WHS intelligence dashboard. So what we were able to create was a Continental Health Intelligence Operating System. Is an executive summary. I think I'll be able to read through both with a vision. The Atlas WHS intelligence dashboard is envisioned as a continental scale health intelligence platform designed to support governments, ministries of health, humanitarian organizations, research institutions, and global health partners in making faster, more informed decisions. Rather than functioning as a traditional reporting dashboard, Atlas serves as an operational intelligence layer that continuously integrates health information from multiple sources, analyzes relationships across the healthcare ecosystem, predicts emerging risks, and recommends coordinated actions. The platform is intended to transform fragmented healthcare into a unified operational picture, enabling stakeholders to move from reactive crisis management to proactive health system governance. The vision is modern healthcare systems generate enormous volumes of data every day, yet much of this information remains isolated within hospitals, ministries, laboratories, NGOs, donor agencies, and surveillance programs. These disconnected systems make it difficult to identify emerging threats, allocate resources efficiently, or coordinate responses across institutions. And so we are able to seek a bridge to these gaps by creating a unified intelligence platform that combines data engineering, knowledge graphs, artificial intelligence, geospatial analytics, and decision support tools into a single operational environment. Instead of merely showing what has happened, the platform aims to explain why events are occurring, forecast what may happen next, and recommend evidence-based actions. And so the guiding philosophy behind this is that healthcare is not simply a collection of hospitals and databases, but merely a living network of interconnected organizations, people, infrastructure, diseases, resources, and policy. And so therefore, imagine, this is more of a case study narration. So imagine if Africa had a nervous system, not merely a nervous system made of neurons, but one from hospitals, labs, ministries of health, humanitarian organizations, research institutions, satellites, and artificial intelligence. A system that could sense problems before people even realized they existed. A system that didn't simply report yesterday's health crisis, but predicted tomorrow's. And so we're able to architect the next generation of continental health intelligence. Uh, I'll move on into the dashboard overview in a few seconds. And so we have a few functional layers. This is a data ingestion layer. Its purpose is to continuously gather information from numerous independent sources, and the independent sources are from the National Ministry of Health databases. These are basically the databases, data sources where we extract our data. And then we also have the data normalization engine. The purpose, healthcare data often arrives in inconsistent formats. One may arrive from the Ministry of Health, another from the ministry, but the function is to standardize, okay, these are the functions. Instead of rather, this is more of a PDF that explains our entire ecosystem of dashboards that we've been able to build out. So I think I'd rather jump through all of it, considering most of this have components or features that shouldn't be shared. And so the long-term vision for more of this dashboard is to allow us to evolve into a continental health intelligence ecosystem capable of supporting routine healthcare operations as well as emergency preparedness. And our future capabilities that will be able to offer climate health forecasting, cross-border disease surveillance, a digital twin model of healthcare systems, a genomic surveillance integration, a pandemic preparedness planning, public health workforce planning, sustainable development monitoring, and for research collaboration networks. Our conclusion is to represent a vision for an integrated health intelligence operating system that combines data integration, knowledge graphs, artificial intelligence, geospatial analysis, and collaborative decision support into a unified platform. Its primary objective is not to automate healthcare decisions, but to prove decision makers with timely, trustworthy, and context-rich intelligence by transforming fragmented information into a coordinated insight. The platform aims to strengthen preparedness, improve resource stewardship, and support more effective public health responses across Africa. So, let's navigate to more of the dashboard overview. This is what we've been able to architect. This is the Intelligence Directorate, more that happened in 2026. So most healthcare dashboards answer one question: what happened? How many people became sick? How many hospitals reported cases? How much funding was spent? Those are important questions, but they all describe the past. We are able to ask a different question with this system. And what should we do next? That is a difference. That this is not just a dashboard, this is a decision engine. So we're going to explore how it works. Everything begins with data. Across Africa, thousands of organizations generate health information every single day. Hospitals admit patients. Labs confirm diseases. Community health workers submit field reports. Governments publish surveillance data. NGOs monitor humanitarian operations. Weather agencies observe rainfall. Supply chains track medicines. Donor organizations record funding. Individually, each data set tells only a small part of the story, and we're able to bring them all together. And our first layer is more the data ingestion layer. Think of it as thousands of rivers flowing into one ocean. Instead of forcing every organization to use identical software, we accept information from different systems: hospitals, electronic medical records, labs, national surveillance systems, the World Health Organization, the African CDC, supply chain databases, climate models, even satellite observations. Everything flows into one intelligence platform. But there's a challenge. Different organizations describe the same thing differently. One hospital might write, uh, okay, another might write the Ministry of Health, another might write the Ministry Health, and it depends on how you're able to annotate, or probably the computer might be able to see the three different organizations depending on how you're able to define them. Uh, Humans might know they are the same, but if you describe them differently, the computer can understand them differently. And so the normalization engine teaches computers that understanding. It cleans the information, it removes duplicates, it standardizes formats, it verifies quality. And now the data speaks one common language. The information doesn't go into ordinary tables, it becomes something much more powerful: a health knowledge graph. So imagine every hospital, every lab, every ministry, every NGO, every funding organization, every disease outbreak, every vaccine campaign connected together like a living web. Hospitals connect to counties, counties connect to diseases, diseases connect to weather, weather connects to mosquito populations, funding connects to hospitals, hospitals connect to patient outcomes. Suddenly, the computer isn't just storing information, it's understanding relationships. And that's what, makes Atlas intelligent. And now, when artificial intelligence is able to take over, you don't have one AI model. You have several specialized intelligence engines, each solving a different problem. One engine searches for outbreaks before they become emergencies. Another determines where medicines should be delivered first. Another follows funding across multiple institutions to understand whether investments are reaching healthcare facilities and contributing to intended outcomes. Another analyzes patterns of collaboration between organizations to highlight opportunities for stronger coordination. Together, these systems transform raw information into actionable intelligence. So imagine malaria cases begin increasing in Western Kenya. Traditional systems might recognize the outbreak after hospitals become overwhelmed. And with Atlas, we're able to notice the subtle changes much earlier. Labs confirmations arise. Mosquito breeding conditions improve after heavy rainfall. Nearby clinic report increasing because of fever cases. Medicine inventories begin dropping. Population movement increases. The AI combines these signals instead of waiting. It estimates the likelihood of expansion. It recommends where additional diagnostic kits should be, uh, also mosquito nets, and healthcare workers could be okay. It recommends where additional diagnostic kits and mosquito nets should be, and also healthcare workers where they could have the greatest impact. Decision makers receive guidance before crisis reaches its peak. And so this is more of the dashboard that we've been able to build out. And so healthcare isn't just about diseases, it's about resources. We're able to track funding as it moves through the health ecosystem, from international partners to ministries, to regional governments to hospitals, and ultimately to measurable health outcomes. Rather than asking how much money was allocated, the platform helps answer whether programs are reaching their goals and whether implementation delays or bottlenecks may exist. This improves transparency while still relying on human oversight for interpretation. Everything appears inside the living map of Africa, which will be architected within red regions show areas requiring attention. Hospitals display operational status. Funding pathways become visible. Emergency response teams appear in real time. Selecting any location reveals operational details, current capacity, resource availability, connected partners, and ongoing response activities. Instead of reading hundreds of reports, leaders are able to see the entire health landscape in one place. Perhaps the most exciting capability is the simulation. What happens if vaccination coverage increases by 20%? What happens if additional labs are built? What if emergency funding reaches communities faster? And so we're able to estimate possible effects using epidemiological models and historical evidence. Hospital demand, disease spreads, resource requirements, program costs, potential benefits. Instead of reacting to events, leaders can explore scenarios before making policy decisions. And so Atlas was built on a simple idea. A healthier future begins with better understanding. When data becomes connected, knowledge becomes intelligence. When intelligence becomes action, lives can be protected. This isn't about replacing doctors, it's not about replacing governments. It's not about even replacing public health experts. It's about giving them better information earlier by executing a better strategy with greater context so that they can make stronger decisions together. And so what we've been able to build is not just a simple dashboard, it's a vision for our continental health intelligence platform, one that helps Africa anticipates challenges, strengthens coordination, and builds a more resilient health system. So the future of public health isn't just digital, it's connected, it's intelligence, it's collaborative. So thank you for watching. Uh, the border stringency, resource allocation. So that's it. I think I've been able to explain what this dashboard is more or less on a few words or more. And so, you know, click the link, subscribe, tell us what more we can do to improve our videos while we try to communicate on what we've been doing within our innovation ecosystem. So thank you. That's all. Stop it.